Hi, this is Paul Tonko reporting to you from the Rayburn office building here in Washington. It's been a week of time in the district and then the remaining portion here in Washington. The activities over the weekend led up to Veterans Day. They were spread out over several days, and it was very encouraging and very respectful to call to mind the great numbers of people who assembled for parades and ceremonies. We owe a great bit of debt to our veterans who have made certain to secure our freedoms and liberties and to promote our opportunities to freedom-loving people around the world. And so that honor roll of citizens dubbed veterans are very much worthy of benefits that we owe them and their families for their service to America, ranging from employment to education to health care, mental health care, and housing, to name a few. Also, we have continued to work to bring an immigration reform measure to the House floor. The opportunities to reduce the deficit by some $850 billion is what we're looking at here with an immigration reform package. The efforts are to make certain that 11 million individuals are offered the path to citizenship, and where we make certain also that there's an economic strengthening that comes to the ag industry, to healthcare, to engineering and the innovation economy with the incorporation of sound immigration reform. The efforts here also are to focus on veterans. We had, in the shadows of Veterans Day, incorporated the number of veterans who have served as immigrants or yet not naturalized citizens. The numbers are quite significant in terms of those who have perhaps won a Medal of Honor, 20% being immigrants, and many who have served this nation before they're even naturalized. So it was a great opportunity this week to speak on the House floor. And finally, we continue to work with the improvements on the Affordable Care Act, making certain that access to the website is as sound as can be. The virtues of the legislation to enroll 40 million people into universal health care opportunities, to bend that cost curve for health care, are the outcomes that will be achieved if we continue to work steadfastly in a bipartisan fashion. So I call upon both sides of the aisle here in Washington, in the House and in the Senate, to work in a multi-partisan, bipartisan, bicameral spirited way to make things happen. Thank you very much, and we'll talk to you next week.